day. My name is Christopher Denaque, and today I'm going to have a return demonstration of the intradermal injection of the parenteral drug administration. So first is we need to check the doctor's order. So the card of the patient is more reliable than the medication ticket. So I'm checking the doctor's order. So next is we need to check the medication record, administration record, or the MAR. So checks the label of the medication carefully against the EMAR to make sure that the correct medication is being prepared. So ensure that it ensures the correctness of the medication. So I'm going to administer today is sterile water for injection, then a 1 cc syringe. So next is we need to follow the 3 checks for administering the medication. So read the label for the medication. So first is when it's taken from the medication cart. So the next is before withdrawing the medication medication. The next is after withdrawing the medication. So this is to secure the right medication is being withdrawn, and also the packaging has the same inside of its package, or it has the same medication as it is outside. Then next is we need to organize the equipment. So the rationale is it promotes the time efficiency and eliminates delay to the procedure. So I'm going to prepare the medication and the things that I'm going to use. So I'm going to use the gloves and the antiseptic alcohol. So I'm going to use the sterile water and the syringe for easy access. So the next one is I'm going to perform the hand hygiene and observe other infection prevention procedures. So this is to deter the spread of microorganisms. So I'm going to use these antiseptic alcohol. So next is we need to prepare the medication vial for drug withdrawal. So next is we need to mix the solution if necessary by rotating the vial between the palm, hands, and not shaking. So we are going to do this so that the content and sign will be mixed well. So next is we need to remove the protective cap or clean the rubber cap of the previously opened vial with an antiseptic wipe by rubbing a circular motion. So in circular motion, it helps that the microorganism might harbor, that the organisms that might harbor are already leads on the vial. So just to make sure that the needle is still sterile, it is better to clean it. So we're going to use antiseptic wipes. So in my situation, I'm going to use alcohol with cotton with alcohol. So I'm going to clean the vial. So this is to make the needle to be sterile and to deter the microorganisms that may harbor in the lid of the vial. Then discharge. So next is we're going to withdraw the medication. So attaches the filter needle as the agency practices dictates to draw a premixed liquids medication from multi-dose. So multi-dose vial. So rationally, a filter needle will reduce the chance of the glass being introduced into a medication. So next is we need to ensure that the needle is firmly attached to the syringe. So to secure that the needle will not be left in the vial's rubber when being removed. So make sure that the syringe is being attached to the syringe. The needle is being attached to the syringe. So next is remove the cap from the needle, then draw up into the syringe the amount of air equal to the air equal to the volume of the medication to be withdrawn. So the rationale is to make sure that there are no bubbles when the medication is being drawn. So I'm going to use 0.1 cc or units. Then next is carefully insert the needle into an upright vial so that of the center of the rubber cup. So maintaining the sterility of the needle. So the center of the rubber cup is sterile because it was cleansed with an antiseptic gauze. So I'm going to insert. The next is inject the air into the vial, keeping the bevel of the needle above the surface of the medication. So this keeps the vacuum forming. If you put it too little air, you will find it hard to draw out the medicine. So withdraws the prescribed amount of medication using either of the following methods. So holds the vial down, or example like this. So move the needle tip so that it is below the fluid level and withdraw the medication. So this is that part. So the next is inverse the vial, ensure that the needle tip is below the fluid level, and gradually withdraw the medication. So I'm going to use this. So and withdraw the medication. So next is we are going to do the intradermal administration. Explain the clients that the medication will produce a small wheal, or some call it a bleb. A wheal is a small raised area like a blister. So the client will feel a slight prick as a needle enters the skin. So good day, ma'am. Today, ma'am, is mag-explain ko sa procedure nato today, ma'am. So, we're going to do the skin test, ma'am. So, explain ako sa ma'am, nga na siya yung itabo sa mga hands, or dili siya kanang dangerous man, ma'am. So, nay mag-form na lingin sa imong skin po, ma'am, diya na part sa imong arm. So, ginatawag na siya og bleb. Ang bleb is kana siyang blister siya sa imong kamot when kanang itusok na to sa injection. Kaya dira na ito mabalaan, ma'am, if allergic ba ka sa medication or dili. So pag-inject ato, ma'am, pag mag-form siya circle na siya slightly maka-feel ka slightly pain if ka na itusok sa needle. So kato lang, ma'am. So next is we need to provide clients for privacy. This is to gives patient less anxiety and can cooperate to the procedure effectively. So by doing that, we can close the doors or the curtains from the windows, or close the windows to provide privacy to the patient. So next is we need to select and cleanse the site. So select the site, for example, the forearms are about the hands width and above of the wrist. So, and 3 or 4 fingers widths below. Avoid using sites that are tender, inflamed, or swollen, and those that have lesions. So, like here, we're going to administer the medication right here. So, ma'am, paano na ko, mama? So, we're going to administer the medication. So, before applying the intradermal injection is we need to apply gloves as indicated as by the agency policy. So, we need to cleanse again our hands, then cleanse the skin at the site using the firm circular motion. So, So next is we're going to cleanse the skin of the site. This is using with a firm circular motion. So for today, I'm not going to inject the stuffed toy, so I'm going to use an eggplant. So using circular motion. So this is example for that. Next, prepare the syringe for injection. So we need to remove the needle cap while waiting for antiseptic to dry. So expels the air bubbles for the syringe, and small bubbles that adhere to the plunger are of no consequence. So grasp the syringe with your dominant hand close to the hub, holding it between the thumb and the forefinger. So hold the needle and almost parallel to the skin surface to the bevel of the needle up. So, next we're going to inject the fluid. So with the non-dominant hand, pull the skin at the site until it's taut. For example, if using a ventral forearm like here, so grasp the client's dorsal forearms and gently pull to tighten the ventral skin. So you're going to pull. So this is easy to insert the tip of the needle so far enough to place the bevel through the epidermis to into the dermis. So after that, we're going to insert like this. So like this. So in a 15-degree angle, so we're going to insert the needle. So just only a little bit of the bevel or the needle. So don't push too hard, so that the patient will not going to feel pain. So more pain rather. So we need to withdraw. So first is we're going to 15-degree angle. So just like this. So next is we're going to stabilize the needle, the syringe and the needle. So inject the medication carefully and slowly so that it produces a small wheel on the skin. So we thrust the needle quickly at the same angle in which it was inserted. Activate the needle safely at safety advice. So applies bandage if indicated. So we're going to withdraw. So as we can see, there are the medication has been withdrawn. So because we're not using skin of the patient, so we're just using an eggplant. So we're going to withdraw the needle. So applies bandage if indicated. So the next thing you're going to do is you must not massage the area. So massaging the area can cause tissue damage. So if you can see a red wheal or the blisters of the hands of the patient, if they are at the surrounding of the blisters, there are some irritations occurs. The patient might be allergic to the medication. So then next is we need after administering the medication, so we need to encircle the the hands of the patient, so that we note for the result. So first is we need to remove and discard gloves. So after removing the gloves, is we need to perform again hand hygiene. So This is to deter the spread of microorganisms. Then, next step is we need to encircle the injection site with the ink to observe for redness and duration. So, do not use red ball pen for encircling the site. So, I'm going to use black ball pen for encircling the site. So, next thing we do is we need to document all relevant information like records, the testing materials given, the time, dosage, and the route. So, the material given is sterile water. Then the time is 8 a.m. Then the dosage is 0.1 cc or units. Then the route is intradermal. So we need to evaluate the condition of the site for 30 minutes. So depending on the test measures, the area of redness and in duration of millimeters are the largest diameter of the document findings. And next is we need to document if the client's positive or negative skin test result by follow the agency protocol and labeling of allergies. So, I've noted that the patient is negative for skin tests. So, the patient has no allergies for the skin, for the at the skin. So, that indicates that the patient has no severe reaction or allergic reaction for the medication. So, I am done with, so I'm going to do the aftercare. So, I am done with the procedure of intradermal. So, thank you and good day.